Good evening. My name is Jesus Manny Estrada. I am the Chief Operating Officer for Cermak Health Services with the Cook County Health. I want to thank Health and Medicine for the honor of being recognized for the work that we do at Cermak Health Services. I also want to take a moment to thank my wife, Angelica Estrada, my children, Max, Cesar, and Reina Estrada. It is with their support that I've been able to accomplish and be successful in my career. I also want to thank my colleagues and my county family, specifically and principally Dr. Linda Murray and Andrea Munoz. They both have played a part in starting me in this career and maintaining me in the path of providing the health for our patients at Cook County Health. My career spans over 35 years in healthcare, most of which has been spent with Cook County Health. In that time, I've had varied roles. Two of the most privileged roles that I've had have been as the Executive Director for the Jorge Prieto Family Health Center and my current role as the Chief Operating Officer for Cermak Health Services. In both of these roles, I have been able to live the core mission of the county, which is to provide health care for those, regardless of who they are. At Cermak and in my career over the last 15 years in corrections health, we live this mission daily. We make a choice. We choose to work at Cook County Jail. We choose to enter in and work in an environment that's difficult, sometimes chaotic, but nonetheless, it's a choice that we make because we do make a difference to those that would not have services if it weren't for us. I want to take a moment to finally thank, again, Health and Medicine. I want to thank my family, and I also want to acknowledge and thank my colleagues at Cermak Health Services. They make my life and the ability to do the work viable. They provide the inspiration to be able to live the words, "We make a difference." Thank you.
I am honored to be recognized with the Health Award from Health and Medicine. I have had the privilege of working with and for Chicagoland adolescents for the last decade. In my current role at Lurie Children's Hospital, Potocsnak Division of Adolescent and Young Adult Medicine, and in my previous role at Chicago Public Schools, I've worked with my teams to expand youth access to sexual health education, sexual health services, and LGBTQ+ inclusive environments. I'm particularly proud of the various inclusion efforts we've made to affirm and celebrate transgender and non-binary young people. Now more than ever, trans youth need adult allies working on their behalf. Thank you, Health and Medicine, for the recognition of this life-saving work. Thank you to Kara Beskin for nominating me, and to the team and leadership at Lurie Children's Hospital for fostering a healthy work environment from which we can persevere in the face of cultural vagaries. I'm immensely grateful to the school staff who work tirelessly to meet students' needs, teachers, school counselors, school social workers, administrators, school staff, and especially GSA advisors, all of whom have taught me something along the way. Thank you to the young people and their parents and caregivers who have advocated for their needs. Thank you to my queer family, my partner, and my two beautiful cats for creating the emotional foundation from which I can keep advocating for trans and queer youth and sexual health education for all young people.
Good evening. My name is Dr. Dan Lustig. I am the President and CEO of Haymarket Center. It is a tremendous honor to accept the Medicine Award from the Health and Medicine Group. To be acknowledged by an organization whose mission is rooted in advancing health equity, community engagement, and evidence-based policy is both humbling and profoundly meaningful. Health and justice are inseparable, and I long believed that access to quality care, especially for our most vulnerable neighbors, is not a privilege but a human right. Tonight's recognition is not about one individual. It represents the tireless work of so many of my colleagues, community partners, and especially the people we serve every day at Haymarket Center. In my work, I've always viewed medicine not only as a science, but as a moral responsibility, a commitment to healing both individuals and systems. Whether at the bedside, in a clinic, or shaping public policy, we are called to treat not just illness, but injustice. At Haymarket Center, we are driven by the belief that recovery, primary health care, and dignity go hand in hand. We have seen firsthand the impact that compassionate, data-driven policy can have, from substance use treatment to behavioral health to the social determinants of health that shape outcomes long before someone walks into a clinic. We must keep pushing for systems that work for everyone. I want to thank Kevin Conlon and Linda Shapiro for this nomination. We have worked as a collaborative team at Forging Roads to Better Healthcare. To my team, thank you for your relentless commitment, your heart, and your belief in what's possible. Your dedication inspires me every day. To my husband, who has stood tirelessly by my side for the past 28 years as we continued the path of healthcare with the Northern Star of having healthcare for all. Thank you.
Good evening. I am beyond honored to accept the 2025 Health and Medicine Policy Award. When I first learned that I was nominated for this award by my colleague Bridget Magner, hi Bridget, I thought it was really gracious of her to nominate me. But I couldn't imagine being selected because there are so many other people with more experience and accomplishments than mine. So I salute you all that have been influencing policy for far longer than I have and to whom I look up to. Thank you for your mentorship, support, and guidance. I became aware of systemic oppression and health inequities when I was about 9 years old, when my brother's healing process after a fracture was full of pain and trauma. As such, the work that I do now is very close and dear to my heart. Fast forward a few years, when my parents migrated here, we met a community health worker at the corner of Kimball and Lawrence in Albany Park that talked to us about Erie Family Health Centers. She said everyone was welcome there, regardless of their background. It is my privilege to advocate for access to high-quality health care for all because healthcare is a human right. At one point, I thought it was my job to be the voice for those that did not have a voice. However, over the years, I have learned that everyone has a voice, and it is much more powerful to help them find and use their own voice. I follow in the footsteps of so many community organizers, advocates, and policymakers that have paved the way for people like me to be active participants of the legislative process. I accept this award on behalf of my immigrant community, on behalf of Erie and my amazing colleagues and mentors that believe in advocacy. And last, but never least, on behalf of my family, my parents who sacrificed everything to give me opportunities they didn't have, and my brother, who is an amazing artist and is one of the strongest persons I know, even though he doesn't see it yet. I also accept this award not just in recognition of the work that I've done, but as a challenge to keep advocating with and for people of all backgrounds so that we may influence policies that benefit everyone and not just a few. Thank you.
I am honored and humbled to receive Health and Medicine's Research Award. First, I want to thank my colleagues and nominators at Women Employed, Estrada Sasahuli, Tara Driver, Chris Warden, and Sharmili Majmadar. I am proud and honored to work alongside you. Second, I'd like to thank my research mentors, Dr. Marilyn McEwen, Dr. Jeff Milam, Dr. John Dugan, and Dr. Oyon Poon, and all of the other amazing scholars I have had the opportunity to learn from and collaborate with. Most importantly, I'd like to thank my family, particularly my husband, Richard, for supporting me in my professional endeavors, including while I was pursuing a PhD later in life. Receiving an award from a health and medicine group is not something that I would ever have imagined, given that my background is in higher education. However, I realize that equity research has been a through line regardless of where I have worked, whether it be studying Asian American student experiences, career choices for women in academia, or healthcare career pathways for low-paid women of color. At this moment, I'm very concerned about attacks on data, research, and science, whether it's restricting access to publicly accessible data, discontinuing federal data collection, or cutting off research funding. I urge all of you to push back on these threats. I also encourage philanthropy to provide research grants, particularly to those of us outside of academic institutions who have little resources for which to pursue our equity research interests. Thank you again for this recognition of my work.
To be acknowledged by your peers is the highest compliment. On behalf of the hundreds of colleagues, partners, and volunteers who make up our PIES network, I am deeply appreciative of this recognition. Through PIES, we've built a powerful network of over 150 community health workers, bringing health systems in our community, breaking down barriers, and making resources accessible in ways that honor our culture and our people. To our partners, funders, and especially our volunteer staff and group of community health workers, thank you. The work is possible because of your dedication, your courage, and your belief that health is a human right. This honor belongs to all of us.
En la Villita y en todo el área de Chicago, las y los promotores comunitarios de salud somos el puente de confianza entre nuestros vecinos para brindarles la atención que merecen. Apoyamos con aplicaciones a las personas con seguro médico, asistencia de alimentos, vivienda, recursos de salud mental y atención preventiva. Caminamos junto a las familias ayudándoles a navegar sistemas complejos, comprender y tomar acción. A través de Enlace y la red de PAES, hemos desarrollado habilidades de educación en salud, abogacía y alcance comunitario y conexión con recursos, habilidades basadas en la confianza y el entendimiento cultural. Hoy, nuestro trabajo es más urgente y necesario que nunca. Con los recientes recortes federales y estatales a Medicaid, miles de personas están perdiendo su cobertura y pasando a formar parte de la población sin seguro. Las y los trabajadores comunitarios somos muchas veces la primera y a veces la única conexión que tienen para recibir atención e información. Estamos aquí para asegurar que nadie se quede atrás, porque la salud no es un privilegio, es un derecho humano. En nombre de todos los 150 promotores de salud que acuden a la red de PAES y que han formado en los últimos 10 años, les damos las gracias por este reconocimiento.
Good evening, everyone. My name is Dana Pham, and I'm an incoming second-year medical student at the University of Chicago and a health advocacy volunteer with the National Psoriasis Foundation. I'm incredibly honored to receive the Emerging Leader Award with Health and Medicine. Thank you for recognizing not just my work, but the lived experiences that shape it. As a medical student from an under-resourced community living with psoriasis and psoriatic arthritis, I've learned firsthand how systemic barriers like insurance delays, step therapy, and community disinvestment and resource disparities can shape a person's experience of illness just as much as the disease itself. And navigating these challenges as a multiply marginalized patient has ignited my passion to fight for a healthcare system that centers equity, accessibility, and dignity. Health and Medicine's commitment to health justice has been a source of both inspiration and solidarity for me. So to be uplifted by an organization that's long championed structural change in Illinois is deeply humbling. I see this award not as a culmination, but as a call to keep going, to keep listening to patients, amplifying unheard voices, and pushing institutions to do better. I want to thank my mentors, my peers, fellow advocates who have helped me grow, and my family, especially my parents, whose sacrifices and love laid the foundation for everything that I do. And to my fellow awardees, congratulations. To the National Psoriasis Foundation and the Pritzker School of Medicine, thank you so much for consistently making spaces for me to pursue my passions and supporting me. And lastly, to Health and Medicine, thank you for believing in emerging voices. I'm so proud to be standing alongside you today in this fight for a more just healthcare system. Thank you so much.